Welcome back. Well, it's Lung Cancer Awareness Month, and Dr. James Caccitolo with CHRISTUS Trinity Mother Frances Heart Hospital is here to answer all our questions. How are you?
Wonderful, thank you.
Great to have you. So this is important to talk about. It's Lung Cancer Awareness Month. What is one thing that people don't normally know about lung cancer?
Well, obviously everyone assumes that lung cancer is from smoking, but patients who have never smoked can also get lung cancer. And there's additional risk factors other than just smoking. So asbestos exposure, exposure to dust, silica, heavy metals, and radon exposure, which is more common in places with basements and things like that.
And is it common for people to have, is that pretty common for people to have lung cancer that have never smoked in their life?
Well, no, the most common situation is when somebody's been a long-term smoker.
Okay.
But it's not unheard of, and we do see patients who've never smoked and do develop lung cancer.
And so how common is lung cancer in general compared to other cancers?
Well, lung cancer varies from state to state, usually related to smoking rates. In some states, it's the most common cancer. In Texas, it's probably second behind breast cancer, but lung cancer is usually much more fatal, and it is the leading cause of death among all cancer patients. In fact, the number of patients who die from lung cancer is more than the combination of patients who die from colon, breast, pancreas, and other cancers combined.
Wow. Okay, and then how can CHRISTUS Trinity Mother Frances help us? What is the process like?
Well, the most important thing is for patients who are in the high-risk category to be considered for lung cancer screening. And we do that now with a very low-dose CT scan, which scans the chest. And if we can identify nodules or lung cancers early, the likelihood of cure with appropriate treatment is much higher. So we try to inform patients that if you fall in the category of high risk, meaning you smoked more than 30 years or 30 pack years, are older than the age of 55, and quit less than 15 years ago, you should talk to your physician about lung cancer screening.
Okay, if people have questions about this, where can they contact you?
Well, we're available at the Lung Care Center at CHRISTUS Trinity Mother Frances, and our number is 606-LUNG, so easy to remember.
That's easy, yeah.
Yeah, we can easily arrange a screening scan, which can be done through your insurance or for a low cash price, and we're happy to evaluate you and talk to you about your risk for lung cancer.
Thank you so much. It was great to have you.
Thank you.
All right, we'll be right back.